So it's a good time to be a Victorian and an Australian. When we look around the world and we see what's happening with the COVID pandemic, we see scenes that really are challenging for people to survive and live through. And we're not seeing those in Australia, due largely to the public health measures that we've seen implemented at a state and national level. From a hospital and a health service perspective, we've been asked to prepare for the worst. And the worst is now not looking nearly as bad as it might have because of those social and physical distancing restrictions that we're all experiencing. So I'm grateful for all Victorians and our local community who's really gotten behind our health service and us as health professionals. We've had messages from individuals and from teams, from businesses and community members just supporting us in the work that we have to do. We've had financial support and donations that have been really important to us at this time. But we've also had an impressive flattening of that curve, which really speaks to the way that Victorians have gotten behind their role and responsibility. From a health service perspective, we're planning for an increase in capacity due to the COVID-related infections and the disease that comes from that. That includes being able to take more patients to our wards and more patients into intensive care when they need it. The number of patients that we're expecting now is still quite possibly much more than we have seen before, and that's what we're planning for. We've bought time. We've bought time by delaying and flattening that curve, and that time has really given us, as you can see, the opportunity to prepare even equipment, and the ventilators behind me are a testament to the fact that we're not overwhelmed at this stage and that we're well prepared to be able to manage surges that may come in the near future. Future presentations of COVID are likely to relate to outbreaks rather than a full pandemic. For that reason, it's fundamental that we can contact trace people who might have this disease, who are catching it in the community. And for that reason, I've downloaded the COVID tracing app, and I've encouraged all of my friends and family to do the same.